Hello, everybody, and welcome to this recorded session. I am Julie Martin, and I'll be your presenter today. We're going to be looking at occupational exposure to bloodborne pathogens. You can find the standard for that in 1910-1030 if you want to follow along with a standards book. So at the end of this course, you should be able to understand the basics of the bloodborne pathogen standard, as well as understanding OSHA's requirements regarding bloodborne pathogens. This is going to include needle stick safety provisions. The 1910-1030 or bloodborne pathogen standard, this applies to all employees who have occupational exposure to human blood or other potentially infectious materials. The bloodborne pathogen standard covers many types of occupations, including those in healthcare facilities like hospitals, dental and physicians' offices, blood banks and plasma centers, and even nursing homes and long-term care facilities. Non-healthcare facilities that are under the standard can include companies that service and repair medical and dental equipment, infectious waste disposal operations, law enforcement and correctional institutions, as well as institutions for the developmentally disabled. And workplaces can be both permanent and temporary work sites and still be under the standard. It really depends on is there exposure. As I mentioned previously, employees can be exposed to bloodborne pathogens even at temporary or transient operations. Trauma or rescue scenes. Blood is there, blood is present, while you have rescue workers, EMTs, etc., all attempting rescue or providing aid, prepping people for emergency travel. These employees are definitely exposed, and they have to be covered by a bloodborne pathogens plan. Mobile blood banks. For example, the employees, the phlebotomists, they're drawing blood. They're removing and disposing of blood-contaminated needles. Again, they have exposure. Crime scenes. Now, we've all seen those shows like CSI and etc. Real crime scenes are potentially just as bloody. Technicians processing those scenes, the cleanup workers as well, they come by afterwards. They're all potentially exposed. And what about collateral first aid duties? If you have someone that's at your job, they're trained to provide first aid, they're a first aid responder. They are at risk and they must be covered by the standard. If an employer requires an employee to be trained in first aid and CPR, and that they're designated by the employer to provide that type of medical assistance, they are considered to have occupational exposure. If you look here in the picture, this is an example of a first aid responder in action. So what about bloodborne pathogens at a multi-employer work site? Employment agencies or employment recruiters. If those agencies only refer applicants and the employees are not actually on that employment recruiter's payroll, there's no employment relationship established. And the recruiter is not the employer. However, the user or host employer, such as the hospital, is the employer according to the standard and is responsible for the bloodborne pathogen standards requirements. Now, personnel services or temp agencies, they can employ and pay the staff, often assign employees to work at a healthcare facility. Then typically the healthcare facility exercises day-to-day supervision over that employee. Now in that case, both employers, that's both the personnel service or temp agency and the hospital or healthcare facility, are responsible for ensuring compliance with the standard. Now, the temp agency is responsible for ensuring that hepatitis B vaccinations occur, that post-evaluation and follow-up happens, record keeping is maintained, and just generic bloodborne pathogen training is provided to the employees. Now, a healthcare facility, they can be cited if it did not reasonably try to correct personnel services deficiencies by not exercising reasonable diligence. The healthcare facility is also responsible for providing facility or job-specific bloodborne pathogen training. Now, home health services, they're supplying service to a patient home. These home health services, or HHS, they're responsible for site-specific requirements of the plan, such as HPV vaccinations, post-exposure evaluations and follow-up, record-keeping requirements, that generic bloodborne pathogen training that must be performed, as well as supplying PPE. You also have to look at independent contractors, and this can include many different job positions. It could be workers in radiology, EMTs, or even housekeeping. Both companies, the independent contractors and the healthcare facility, are responsible for compliance with all requirements of the standard. Now, physicians and healthcare professionals can also have established an independent practice. Now, the employment status of the physician is important. The physician may be either self-employed or an employee itself. Now, if they're the employer, do they have at least one employee? You need to find that out. Do they control or create bloodborne pathogen hazards? If so, they are responsible for the requirements of the standard. Now on this slide, you see the types of employees who are typically at the highest risk of exposure. What about dentists and dental hygienists? Why do you think they're on this list? Saliva. Yeah, your gums are tender things, and it's easy for them to bleed after a cleaning. And of course, if you're there having dental surgery, a tooth extraction, there's definitely going to be exposure to blood. Another one to think about is laundry and housekeeping employees. A lot of medical facilities, they have these tasks contracted out to another agency, or they can have in-house staff. But these employees can be exposed to blood and other potentially infectious materials on clothing, uniforms, bed linens. They could be tasked with cleanup of areas where blood and other potentially infectious materials are present. Sharps could become mixed into the laundry, exposing them to needle stick injuries, for example. Med techs and phlebotomists, they're all exposed. They all have exposure to blood. In North Carolina, the state added that if employees who are required and or expected to perform first aid duties as a part of their job, that they fall under the requirements of the bloodborne pathogen standard. Now, the NCDOL enlarged the coverage of the bloodborne pathogen standard in 1995. This made the General Industry 1910 standard applicable to construction activity in North Carolina, not just general industry. Now, this is important because the 1926 construction standard has provisions requiring prompt medical attention be provided, or if medical care is not promptly available, the rendering of certified first aid. Here's a list of many of the most important terms from the bloodborne pathogen standard. We're going to review each of these in the following slides. Now, blood in the bloodborne pathogen standard, it means human blood components, and or products made from human blood. This does not include blood from other animals. Now, there are limited exceptions. Laboratories that work with the blood of animals experimentally infected with HIV or HBV, they are covered by the standard. When you see bloodborne pathogens in the standard, it's referring to pathogenic microorganisms that are present in human blood and can cause disease in humans. These pathogens include, but are not limited to, the hepatitis B virus and the human immunodeficiency virus, or HIV. Now, one interesting fact about hepatitis B is a contaminated surface with hepatitis B can remain contaminated for several days. This is highly unusual, but it stresses the importance of proper cleanup and housekeeping. Hepatitis literally translates to inflammation of the liver, and it can occur by multiple causes, including viruses, poisons, even alcohol and drugs. Now, there's 6 types of viral hepatitis. Hepatitis A and E, they're most commonly GI transmitted, which simply means you eat or drink something contaminated with the virus. With hepatitis A, this means a person typically gets infected by somehow ingesting contaminated feces from a contaminated person. Lesson from this, wash your hands after using the bathroom, people. On the plus side, if you are potentially exposed to poop, there is a vaccine available for hepatitis A. Now, hepatitis E, that's not that common here in the United States. Transmission here is usually from someone eating undercooked pork or wild game, such as deer. Now, in developing countries, hepatitis E can be spread by drinking contaminated water due to poor sanitation. In very rare instances, it has been shown to be transmitted through blood transfusion. Now, there's no vaccine for hepatitis E in the United States, but there is one currently in China. Now, hepatitis B is what is called environmentally robust, which simply means it's relatively hard to kill. It can live on surfaces for up to 7 days. Now, hepatitis B is spread through contact with blood and other potentially infectious bodily fluids. That's also hear that called OPIM. Now, the good news is there is a vaccine, and we will touch on the vaccine more in a little bit. Hepatitis C. Now, this is the most common chronic viral bloodborne infection, and new cases have been on a steady rise since 2006. There is no current vaccine. However, antiviral treatments are available and can cure hepatitis C in most people with the disease. Hepatitis D. Now, it's very unusual in that you can only get infected with hepatitis D if you also already have hepatitis B. So the best way to protect yourself from Hep D is just keep yourself from getting hepatitis B. Get the vaccine. Hepatitis G is a distant relative to hepatitis C and is very rare. It is also a viral bloodborne infection. Most people who have it are asymptomatic. Now, when you're looking at hepatitis in general, the most common symptoms are flu-like, such as nausea, vomiting, and fatigue. But it can also include jaundice, fever, and lead to cirrhosis or scarring of the liver. It can lead to liver failure, liver cancer, and even death. So HIV stands for Human Immunodeficiency Virus. Now, that HIV is the virus that causes acquired immune deficiency syndrome, or AIDS. Now, AIDS is a serious condition that affects the body's immune system, the body's natural ability to fight off infection. Now, HIV is not passed by casual contact. Like hepatitis, early symptoms can be very much like the flu. Unfortunately, many people do not develop any symptoms at all when they first become infected with HIV. Some people, however, will have a flu-like illness within a month or two after exposure. Now, currently, the average time between HIV infection and the appearance of signs that could lead to an AIDS diagnosis is between 8 to 11 years. Now, this time varies greatly from person to person and can depend on many factors, including a person's health status and behaviors. And they are coming up with better medicines all the time that can hopefully prevent AIDS from ever coming on at all. Now, here we see some other pathogens of concern. Now, almost all of these illnesses are associated with a fever, and many are reportable communicable diseases here in North Carolina. Many of these I know you're probably familiar with: malaria, syphilis, brucellosis. Some that are a little bit more unusual: Creutzfeldt-Jakob disease. That is a rapidly progressive fatal neurodegenerative disorder. It's similar to mad cow disease. And viral hemorrhagic fevers. There have been a lot of those in the news, it seems like, in the past few years, such as Ebola. Obviously, if you get something like that showing up in your workplace, it definitely does need to be reported. Other potentially infectious materials. You'll usually see this shortened to OPIM. Now, most people, unless in a medical field, they're not going to contact these substances, except perhaps if you're performing first aid or first responder duties. Now, look at the examples on this slide. We all go to the dentist. Even just getting our teeth clean can lead to blood mixing with saliva. And we talked about this earlier. This is why dental hygienists have to be included in a dental office's bloodborne pathogen program. Now, OPIM literally means human bodily fluids. This can include semen, vaginal secretions, cerebrospinal fluid, pleural fluid. I mean, the list just keeps going on. Saliva. The simplest thing to do is any bodily fluid that can be visibly contaminated with blood. And when in doubt, if it's a bodily fluid, just assume that it's potentially contaminated. And we'll actually go into more detail about that thought process later. A surface is considered contaminated if the presence of blood or OPIM has occurred or is reasonably anticipated to occur. If so, precautions have to be taken. Now, when personnel are cleaning up blood or OPIM from any surface, they have to use protective gloves and proper cleaning and disinfecting chemicals. Now, I didn't mention this previously, but in my former life, I was a chemist. If we saw a spill or a wet surface, we just assumed it was probably hazardous. And that's a good rule of thumb to assume the same thing if you're dealing with potential occupational exposure to blood. Just assume that it's probably contaminated with blood. Occupational exposure. This is defined as reasonably anticipated skin, eye, mucous membrane, or parenteral contact with blood or OPIM that may result from the performance of an employee's duties. Now, parenteral contact, I can't remember if I told you what that means. What that means is it's contact other than through the mouth. You're not digesting it, you're not ingesting it. Simply put, parenteral equals injected. It means it's piercing your skin. An exposure incident is defined as a specific incident where eye, mouth, other mucous membrane, non-intact skin, or parenteral contact with blood or OPIM results while an employee is just performing their work duties. Regulated waste. Now in the standard, this is liquid or semi-liquid blood or other potentially infectious materials or other contaminated items that could release blood or OPIM in a liquid or semi-liquid state when compressed. Now this also includes items that are caked with dried blood or OPIM and are capable of releasing those if they're being handled. Pathological and microbiological waste containing blood or OPIM are regulated, as well as contaminated sharps. So, quick question for you. What about Band-Aids? Do they count as regulated waste? No, they're not, which is lucky. Bandages which are not saturated to the point of releasing blood or OPIM, if they're compressed, would not be considered as regulated waste. So the Band-Aid you put on a paper cut at work, it just wouldn't count. Now typically, special disposal companies have to come, pick up, and dispose of your regulated waste. CSIP. This is sharps with engineered sharps injury protection. Now this is defined as a non-needle sharp or a needle device used for withdrawing bodily fluids by accessing a vein or an artery, or it could be used administering medications or any other fluids. The big deal here is it has a built-in safety feature that effectively reduces the risk of an exposure incident. Now, CSIPs employ engineering modifications generally involving one of the following strategies. They eliminate the need for a needle at all, such as substitution. It permanently isolates the needle so that it never poses a hazard. Or it provides a means to isolate or encase a needle after use. Now here's an example of a CSIP. This is used in infusion therapy. It uses a retractable technology to protect the employee. After injecting the medication, further depression of the plunger activates an internal mechanism that just pulls that needle into the syringe without the employee having to risk contact with that contaminated sharp. Now this activated syringe must then be placed in a sharps box for disposal. Needleless systems. Now these are systems that are obviously needleless. These are a great way to remove the potential of a needle stick injury. For example, there are needle-free injection devices available that can be used for insulin injections, vaccines, etc. The ones I have seen deliver the medicine or vaccine either intramuscularly or subcutaneously by means of a narrow, precise fluid stream through the skin. If you have the potential for exposure at your company, you have to have an exposure control plan. Now this plan will go over the entire bloodborne pathogens program at that work site. Now this is a general template that you see here, and this can be found at labor.nc.gov, which you can download and customize to fit your needs. Now, the exposure control plan must be in writing and it has to contain the exposure determination of the exposed or covered employees. This essentially means it has to have a list of all the job classifications and job procedures in which the employees have been determined to have blood exposure or exposure to OPIM. It has to also contain a schedule and methods that the employer will utilize to actually implement the exposure control plan. And it needs to list any procedures for evaluating any exposure incidents. In addition, the Exposure Control Plan, or ECP, it has to be accessible to employees, and it has to be reviewed at least annually. This is a big issue. A lot of companies will create and never review or update these. This must be a living document. It must be reviewed, updated, and enforced to ensure that employees are protected. Another thing to keep in mind is your exposure control plan must also be provided to OSHA and NIOSH representatives upon request. Your ECP must be updated whenever any changes in equipment or technology are put in place that will potentially reduce or eliminate employee exposure. It must also document that the employer has, at least annually, considered and implemented safer medical devices where practicable. The ECP also calls for the input of non-management employees when selecting and evaluating the use of new devices. Now, how you solicit or obtain this input is up to you. It is not specified in the standard, but the employees should be those who actually perform the tasks. Let's take a look at exposure determination. Now, as stated before, the employer has to identify all the job classifications where occupational exposure can occur. For example, janitorial staff, when they have to clean up after first aid responders. Now, of note, this determination must be made as if no PPE or personal protective equipment were used for the task. Let's look at some different methods of complying with the standard. We'll look at each of these listed here in the next few slides. Universal precautions. Now, if you remember, I was talking about before, if you see a spill of bodily fluid, just to assume that it's potentially contaminated with blood. Well, the CDC gave that a fancy name. It's called universal precautions. And it's essentially what I said before. If you see any bodily fluid, human bodily fluid, treat it as if it's potentially infectious for any bloodborne pathogen. Let's look at some controls employers need to use to keep employees safe. This here is the hierarchy of controls. In brief, the hierarchy of controls is a system for controlling risks in the workplace. Now, the hierarchy of control is a step-by-step approach to eliminating or reducing the risks inherent in a job. It ranks risk controls from the highest level of protection and reliability, which is eliminating the hazard, through to the lowest and least reliable protection, which is personal protective equipment or PPE. Now, in healthcare, eliminating the hazard in reference to bloodborne pathogens is virtually impossible due to the fact that the employees must continue to interact and treat patients. So today we're going to focus on engineering, administrative controls, and PPE. And exposure determination is vital in determining how to protect employees, and it is required by the standard. Without determining how an employee can be exposed, how can the employer determine effective engineering controls or effective work practice or administration controls? These controls have to be used in conjunction. They have to work together to protect employees from occupational exposure. Now, some examples of engineering controls are those safer syringes we looked at earlier. Remember the CSIPs? Now, for work practices, following universal precautions, ensuring that appropriate PPE is actually being used by the employees. Now, the controls that are determined to be necessary to help keep your employees safe, they have to be reviewed and or reevaluated for effectiveness whenever new processes or procedures are being used. Engineering controls must be appropriate for each process and procedure independently. The purchase of one generic device to use facility-wide is considered non-compliant. Now, economic feasibility is not a valid reason for not selecting an appropriate safety medical device. The sponsors of the Needle Stick Safety and Prevention Act identified what would be considered valid reasons for infeasibility. A safer medical device is considered infeasible if it poses a safety and health risk to the patient, it presents a risk to the safety and health of the healthcare worker using the device, or if the device interferes with the performance of a medical procedure. Here, employee training is key. Devices will not be effective if employees don't feel comfortable using them or if they don't know how to use them correctly. Renew training anytime new devices or new medical procedures are introduced, or if you just see evidence that employees have a lack of understanding, if you see near misses occurring. For engineering and work practice controls, the employer has to document their evaluation and implementation in the ECP. And again, you have to review and update that ECP annually. That annual review has to include any updates to engineering and work practices. As we said before, you have to also review any potential devices and new technologies on an annual basis. You must also implement new devices as appropriate and available, and this also needs to be documented in the ECP. You also need to update employee training for new devices and/or procedures, and again, document that in the ECP. Listed here are some examples of engineering controls for bloodborne pathogens. Remember, bloodborne pathogen engineering controls eliminate, isolate, or minimize a bloodborne pathogen hazard in the workplace. Work practice controls are controls that reduce the likelihood of exposure by altering the manner in which a task is performed. However, it is dependent on the employee following the practices for them to be effective. Supervision and enforcement are vital to ensure that employees are protected. One of the most important work practice controls you can teach your employees is simply to wash their hands. After an incident, even if wearing gloves, employees need to wash their hands as soon as possible. Now, are you teaching your employees how to wash their hands? How do you train them to do this? Has anyone ever heard of singing a song while you're washing your hands? The alphabet song or the happy birthday song are perfect. You should be washing your hands for at least 20 seconds or for 2 rounds of happy birthday. Now, maybe don't sing it out loud. You don't want your coworkers to think you might be going a little eccentric. But you can do it in your head. You can do it in your head. Another very important work practice control is to not bend or break contaminated needles. In fact, it's so important, it's specifically stated in the standard. Contaminated needles and other contaminated sharps shall not be bent, recapped, or removed. And a lot of people have gotten injured and infected when trying to do that. Another really important work practice control is to make sure you have proper disposal of your sharps. That means proper containers. Anyone know what the most common problem that you see with sharps containers? It's overfilling. If you ever see a sharps container and it looks like it's throwing up needles, it's not safe. These things have a fill line that cannot go past. Once it goes past that, it cannot be safely capped and closed, and then just moving it becomes a hazard. Also, it says this in the standard as well, don't mouth pipette. Unless you're sucking down some Cheese Whiz, this is not okay. Use a mechanical pipetter or some other device. You never want to try to ingest some blood. No job is worth that. Now, after saying not to do it, don't get mad at me here. Recapping may sometimes be necessary while the same syringe is being used to administer multiple injections. This could be, for example, during surgery. However, it must be disposed of into a sharps container after its final use without recapping. If recapping or similar is used, such as in the surgery scenario, it must be shown that there is literally no other feasible alternative. Also, no food or drink, chewing gum, etc. is to be allowed when you're working with or around blood or OPIM. It's disgusting, right? I was always shocked when working in the lab how many people thought it was okay to eat and drink around the hazardous chemicals and materials that we had in the lab. And now we reach the bottom rung of our hierarchy of controls, personal protective equipment, or PPE. And essentially, appropriate PPE must be provided if it's needed. Now, employees have to be trained in how and when to use, as well as how to put it on and take it off. Gloves especially, they need to know how to take them on and off without contaminating themselves. And again, there's some great videos out there. Have them practice, have them show you. Now, listed here are some examples of different types of PPE which might be needed for protection from bloodborne pathogens. Again, it depends on the exposure and the procedure that an employee is performing. Now, the employer must provide appropriate PPE at no cost to the employee. The employer must also make sure that the PPE is actually worn and used by the employees so that they are protected. Now, that PPE also has to be available and accessible in the workplace in the appropriate sizes that they need. If gloves are too big, too small, if they don't fit, it's not safe. For example, another thing is wearing nitrile gloves that are too small. It increases the risk of a micro hole or tear, or that the gloves might break while using. PPE needs to be cleaned and or disposed of by the employer. Often, the employer will use a dedicated laundry service, which is knowledgeable in handling non-disposable contaminated clothing and linens. Now, PPE can include uniforms, scrubs, etc. If they're PPE, they cannot be worn outside of work nor taken home. You don't want to wash these things at home. You can potentially contaminate your house and take that contamination to your family. Now, gloves must be worn when an employee can potentially come into contact with blood or OPIM. Now, gloves must also be worn when vascular access procedures, such as drawing blood or giving injections, are performed, or when an employee can come into contact with a tool or a surface that is or could potentially be contaminated. Disposable or single-use gloves must be replaced when contaminated, torn, or punctured. They cannot be reused. You can't just wash or decontaminate these. Remember I mentioned before micro tears and holes? They can just too easily occur in this type of glove. You cannot allow for reuse of nitrile, latex, whatever you're using. If they're disposable, single-use, that's all you can do with them. Always follow the manufacturer's recommendations for any reuse or cleaning of PPE. Now, if you have thicker utility gloves, they can be cleaned and reused if they are designed to be reused. And they can be used as long as they continue to provide an effective barrier for the employee. The question you have to ask yourself is, how can you ensure that the gloves are still providing protection? Housekeeping is very important in your ECP, and employers are required to develop and implement a written housekeeping, cleaning, and decontamination schedule for any affected areas. Now, this schedule will need to address the specifics of each affected work area. Now, questions to ask: what tasks or procedures are employees performing? What surfaces are affected or need to be cleaned? What type of soil or contaminant will be present? And then anything else you can think of that would be appropriate. Housekeeping also includes the decontamination of contaminated and potentially contaminated work surfaces. Now, they must be decontaminated after the completion of a procedure, after contact with blood or OPIM, and at the end of the shift. Bins, pails, and cans that are used that can be contaminated or are contaminated have to be inspected. They have to be cleaned. This has to be done on a regular basis or when they become visibly contaminated. Now, reusable items such as sharps shall be stored and processed in a safe manner. When disinfecting or decontaminating surfaces, only appropriate and approved disinfectants are to be used. Now, a household bleach solution of 5% bleach and water is allowed, as well as the disinfectants and the sanitizers that are listed at the EPA.gov website. Now, diluted household bleach solutions may also be used if appropriate for the surface. You want to check the label to see if your bleach is intended for disinfection, and you want to ensure the product is not past its expiration date. Some bleaches, such as those designed for safe use on colored clothing or for whitening, they may not be suitable for disinfection. Now, unexpired household bleach will be effective against coronaviruses when properly diluted. And again, follow the manufacturer's instructions for application and proper ventilation. One thing to always remember, never mix household bleach with ammonia or any other cleanser. Now, that bleach and water solution you want to leave on the surface that's potentially contaminated for at least 1 minute. Now, to make a bleach solution, you want to mix 5 tablespoons or 1/3 of a cup of bleach per gallon of water, or 4 teaspoons of bleach per quart of water. Now, a lot of people don't know this, but bleach solutions are only effective for disinfection up to 24 hours after creating them. So essentially, 1, maybe 2 work shifts is about all you can really use them for. Make sure you check to make sure that the disinfectant you do choose will kill the pathogen that you need to clean up. Some disinfectants are not effective against some pathogens. For example, the disinfectants from the EPA's List C are effective against HIV, but List D is effective for both HIV and hepatitis B. So again, be familiar. If you have contaminated sharps, they have to be disposed of in containers that fulfill the requirements of the standard. They have to be closable. They have to be puncture resistant. They have to be leak proof. And they have to be clearly labeled or color coded so that it's easily recognizable that they're a biohazard. Now, during use, the sharps container must be actually near the work area where it's needed. It must be maintained in an upright position during use, and it must be routinely replaced. Remember, you never want to see a sharps container throwing up needles, right? Contaminated laundry. Now, this is laundry that's been soiled with blood. It's got OPIM on it, or it might even have sharps. Now, laundry has to be placed in bags or containers that are labeled or color-coded. Now, alternative labeling or color coding is permitted if universal precautions are used in handling all laundry. Hepatitis B vaccinations. So, Hep B vaccinations and post-exposure evaluation and follow-up to include prophylaxis has to be available to employees at a reasonable time and place and without cost. They can't be expected to pay out of pocket for hepatitis B vaccinations or anything required and related to that. Now, these have to be performed by or under the supervision of a licensed physician or healthcare professional. And currently, they have to be provided according to the recommendations of the U.S. Public Health Service. Hepatitis B vaccinations have to be made available to the employee after they've received all the required training and within 10 days of the initial assignment to the job that gives them occupational exposure. Now, there's some exceptions from that. If the employee has previously completed a hepatitis B vaccination series, they don't need it again. But the employer must attempt to get the record from the employee, from the previous employer, or from the vaccine provider. Now, if the employer can't get that record, offer antibody testing for them. The employee will need to consent for that in order to confirm immunization status. Now, if the vaccine is contraindicated and they can't take it for medical reasons, you need a letter from a medical doctor for that, and that needs to be maintained. Now, participation in pre-screening to prove whether or not someone is already immune is not required or a prerequisite for receiving a hepatitis B vaccination. Now, hepatitis B vaccinations can be provided at a later date, even if the employee initially declines. Now, if an employee does choose to decline the hepatitis B vaccination, they must sign a statement, a declination form, which is actually in the standard. Go to OSHA.gov. You can download it and print it off as needed. Now, hepatitis B vaccination booster doses must be available to employees if it's recommended by the United States Public Health Service. Right now, though, there are no recommendations currently for boosters. Now, if an exposure incident is reported to the employer, they have to take immediate action. They have to make available to that exposed employee a confidential medical evaluation and follow-up. This has to include, at a minimum, the routes of exposure and the circumstances under which they were actually exposed. They need to have identification and documentation of the source individual unless this identification is infeasible or prohibited by law. The source individual's blood must be tested as soon as feasible and after consent is obtained in order to determine if HBV or HIV infectivity exists. Now, if consent cannot be obtained, the employer has to establish and document that the required consent could not be obtained. Now, when the source individual's consent is not required by law, the source individual's blood, if available, must be tested and the results documented. Now, when the source individual is already known to be infected with HBV or HIV, testing for the source individual's known status doesn't need to be repeated. Also, the employee's consent is required for the collection and testing of their blood for HBV and HIV serological status. Now, the source individual's test results, they must be made available to the exposed employee, but not to the employer. The employee should also be given any information about any applicable disclosure laws and regulations concerning that source individual's identity and infection status. You always want to make sure that confidentiality remains unbroken. As a recap, if you're the exposed employee, your blood has to be collected as soon as possible. You need to give consent. Your blood is going to have to be checked to make sure that there is no infectivity. Now, if an employee consents to baseline blood collection, but they don't want to have HIV serological testing, that sample can be preserved or will be preserved for 90 days just in case they change their mind. If an exposure incident occurs, information must be provided to the healthcare professional who's going to be providing treatment. The minimum of that is listed here. They must be given a copy of the bloodborne pathogen standard. They must be given a description of what that employee does. What are their job duties that are relevant to the exposure incident? They also need any documentation for the routes of exposure and the circumstances under which that exposure occurred. They need any results of the source's individual's blood test if that's already available, and any appropriate medical records that are going to be relevant to that employee. The employer is required to obtain and provide the employee with a copy of the evaluating healthcare professional's written opinion within 15 days of the completion of the evaluation. Now, that written opinion is going to be limited to whether the employee requires or has received a hepatitis B vaccination. If it was for post-exposure evaluation, it's going to include the information you can see here, the evaluation results, and any medical conditions that might require further treatment. In the coming slides, we're going to look at ways to communicate bloodborne pathogen hazards to employees. Warning labels. They warn people. They're labels. They're necessary. They must be affixed to any regulated waste containers, any refrigerators or freezers that are going to contain blood or OPIM. And if you have any other containers that are used in that workplace that are going to store blood or OPIM, whether it be for just storage in that location, if you're transporting it somewhere else or shipping it somewhere else. if it contains blood or OPIM, it has to have a warning label on it. Here you can see an example of a biohazard sign. These labels have to be either fluorescent orange or orange red, at least predominantly so in color, and they have to have lettering and symbols that contrast so that it can be easily seen. Now, if you're working in a research facility that deals with HIV or hepatitis B, labeling, you have to go beyond just regular labeling. You have to actually have signage up. It's going to have similar color scheme to the labels, but it's going to warn you of the area, the hazard in that area, and what you need to do to be able to enter that area at a minimum. One of the most important things you can do for your employees, and as for any safety hazard, is to provide them with effective safety training. Now, for bloodborne pathogens, that training has to be provided at the time of initial assignment to cover any tasks where occupational exposure may occur, and this training has to be repeated at least annually thereafter. Listed here are the contents of the training program as listed in the standard. Now, training, it can't be conducted using only video or computer program alone. It has to include site-specific information, all of the information that's in your exposure control plan. And it also has to have an opportunity for a Q&A session with someone who is qualified to answer those questions. Now, there are no specific courses or certifications required for someone to perform training on bloodborne pathogens, but that person conducting the training, they have to be knowledgeable in that subject matter. They have to be able to answer the person's questions, whether it be about bloodborne pathogens in general to the specifics of how to protect themselves on site. Now let's look at some of the record-keeping requirements. For any employees that fall under the emergency control plan or the bloodborne pathogen standard, you have to maintain medical records for them. At a minimum, that's going to be the employee name and social security number and their hepatitis B vaccination status. Now, if there are any incidents that occur, you'll need to also maintain their examination results, any testing that's done, any follow-up procedures, and any information or written opinions that were provided to you by the healthcare professional. Now, these medical records must be maintained for the length of employment plus 30 years. Training records also have to be maintained. They should include, at a minimum, the dates of the training, the content of the training, and at least summary of what was taught, the names and the qualifications of the trainers, and the names and job titles of all the trainees. Now, these training records have to be maintained for 3 years from the date of that training. The employer is required to establish and maintain a Sharps injury log. This is for recording any percutaneous or sticks that happen from contaminated sharps or needles. Now, the information in the Sharps injury log has to be recorded and maintained in a manner so that the confidentiality of the injured employee is maintained. Now, at a minimum, the log has to contain the type and brand of device involved in the incident, the department or work area where that exposure incident occurred, and an explanation of what happened. How did the person get stuck? How did the needle stick happen? Training records have to be provided upon request for examination or even copying to the employee, to their representatives, from a representative from NIOSH or a representative from OSHA, like a compliance officer. Just like with training records, medical records also have to be provided upon request to the employee, to anyone that the employee has given written consent to, and again, NIOSH or OSHA. And we've come to the end of our presentation. So today we have covered the scope and application of the bloodborne pathogen standard. We looked at a large number of the relevant definitions. We looked at exposure control, the different methods of compliance to the standard. We briefly touched on some of the requirements for HIV and HBV research laboratories. We talked about hepatitis B vaccination and post-exposure evaluation. And we also looked at the required training and the record-keeping requirements as well. Thank you for joining me today, and you guys have a great one.